and to let those folks get onto the audio. This is Amanda Wilson at the Coordinating Center. Just wanted to start out and welcome everyone and thank you for joining today's call. Again, Keisha is out of the country and she's not able to get on the Wi-Fi where she's at, so she is not going to be able to join us today. We'll start out. Tom, do you have any CDC updates for us?
Well, I just want to say how excited I am about this call and about the hearing about PARC, and for the PAPRN people to hear about them, because I think there's lots of potential for collaboration and synergies between the studies that PARC's doing and both the work groups and the core PAPRN studies. I also just want to mention our Arizona colleagues have one success story that maybe they can tell you about later, but basically it's that one of their colleagues was able to get the speed limit reduced with the help of the mayor and some agitating on their part. Those kinds of success stories really play well for us. If others have them, please share them with me. And besides that, nothing else. No news from us.
Okay, great. Thanks, Tom. I do have a few Coordinating Center updates. Keisha wanted to pass along her thanks for all of you that made it to the APHA reception that we joint hosted with NOPRN. I know there were a few of you that went to APHA but weren't in on time to attend the reception, but we'll continue to try to have meetings like that and gatherings at conferences where there are quite a few people going. So if there are meetings during the open mic time, just let us know if there will be several of you attending so we can try to arrange for gatherings at conferences, since I know it's nice to see face-to-face and build a network. And so along those lines, I did also want to give an update on ALR. The Active Living Research Conference, which will be at the end of February, beginning of March. And the registration for the conference is open. The call for abstracts has been closed, and we'll be, we're a little bit behind on notifications because we pushed the deadline back, but I think the notifications will go out around the middle of this month. And so I know that many of you submitted it and are anxiously awaiting the results of your abstract review. So those will be going out soon. We are going to have several PAPRN events there. We're going to have one PAPRN poster that will feature the working groups, and that will be another opportunity for them to talk about the work that they're doing. We have a lot of projects that are now underway. So last year at this time, we were really just starting the groups and didn't have necessarily a lot to talk about as far as projects and work that was going on. And this year there are a lot of subgroups that are already meeting and some projects that are underway. So we're excited that we'll have that opportunity to showcase what's going on and potentially bring some more folks into the group. Do any of the working groups have any questions or comments about that, the poster? I'll be in touch with you about coordinating that and putting it together. And we're also going to do, last year we had a flyer for people to indicate interest in joining working groups, and we'll do that again this year. So any questions about that? Or thoughts or ideas about how to improve or what else we could do there?
Amanda, it's Jamie. Hi. Is there going to be a plan to try and have collaborating centers or work groups or anybody affiliated with PAPRN Network have sort of a satellite meeting like we've done in prior years at ALR? Yes.
So we have not scheduled that time yet, but currently thinking, and your feedback on, is we're planning to have a collaborating center call for about 1 hour, and then to have a second hour of the meeting with all of the working group members and anyone else who's involved in the working groups and is interested in participating in that conversation.
Great. So do you think that'll be like during the conference, on the back end of the conference, like last year, just so when some of us start planning out travel, we know when that's going to be?
Yeah, so we just scheduled there was another satellite meeting that we were trying to make sure we overlap with, and that is going to be on Sunday afternoon, a little overlap with the workshops, but I'm going to try to find time that doesn't interfere with sessions. Excuse me.
Or the activity break.
Yeah, definitely not the activity break. I mean, not the activity break. But I understand that a lot of people, kind of don't come at the beginning or aren't able to stay the whole time. So we're hoping in the middle of the meeting time. There are going to be limited times that's available, or try to schedule it. So I'll sit down and look at the agenda and make sure we announce that time soon.
Okay,
but
great. Thank you.
We won't have it ahead of the workshops early on Sunday or at the very end.
Okay, great. Thank you.
If that's helpful, at least for early planning. And then the other thing we talked about doing is having just a social hour gathering as well. So something informal, and unfortunately we're not able to host anything, but we would we could just coordinate a place to meet up one evening, just to have a little bit of a more informal gathering and opportunity for people to connect with other PAPRN members.
I can't speak for everyone, but I thought that was really fun last year, so count me in.
Yeah, I think it's helpful to have stuff like that. And again, we had tried to coordinate something with HA and want to facilitate those meetings at not only ALR but other conferences as well. So I think that's it for coordinating center updates, unless I think Keisha wasn't able to join, but unless anyone else has any other comments. Eric, did you have anything?
Nope, nothing else.
Amanda, there was some discussion about maybe a PAPRN either breakfast table or lunch table, not as the official meeting, but just as a quasi-social and also information opportunity. Right. So yeah, I guess there's several opportunities. We have our lunch roundtables at the conference, and I was going to talk to the working group leaders to see if we want to have the specific topic areas, or we could have an overall PAPRN. So maybe we can, potentially even have a table for each topic area for the working groups, as well as an overall PAPRN table for people that might not already be involved in the network but have questions about joining. Mm-hmm. Yeah, if we could have that after the poster session, then some of the new recruits would have a place to come. I think it would be, yeah. Okay. I think for either poster session, and we can definitely have it at the first poster reception is on Sunday evening, so we could have the poster then, and then the lunch roundtable to follow for people to have more questions. Good. Okay. So moving on, as Tom said, we are going to have presentations from the Physical Activity Research Center, and I'm not going to provide an overview too much of that because Misha is going to first give an overview, and then we're going to hear presentations. There are 4 different projects that are part of the Research Center, and each of those projects are going to present what they're doing. So with that, I'm going to pass it over to Nisha, and let us just transition the slides here.
Thanks, Amanda.
Yes, and we can hear you.
Great. And you're going to control the slides from there, or do I click and go ahead?
So I'm controlling the slides, and so if I miss a prompt, just say move to the next slide.
Okay, great. Thanks, Amanda, and thanks everyone for having us and hearing about the good work that's happening at the Physical Activity Research Center. We can go to the next slide. So the Physical Activity Research Center is supported by the Robert Wood Johnson Foundation. It's a new center that really focuses on building the evidence, as you can see here, on policies, practices, and aspects of the built environment that promote safe and developmentally appropriate physical activity for all youth and families. The emphasis is on healthy kids and not necessarily that on obesity or healthy weight. And so we build on the focus of a culture of health from the Robert Wood Johnson Foundation, and that again being on healthy kids. PARC was created as part of its commitment for healthy weight, and as they've refocused on healthy kids, and it was announced at ALR last February. Next slide. So the big bets that were part of the original priority setting in the call for the Physical Activity Research Center that relate to us are listed here. The first is that they want to ensure that all children enter kindergarten at a healthy weight. The second is that they want to make sure that physical activity is a part of the school environment. And then last, making physical activity a part of the everyday experience for children and youth. And so these are the three areas that we try to emphasize in the planning grant that I'll talk to you about in just a bit, and then in the studies that follow. Next slide. So the topics that we drilled down into as we moved into the planning grant period include the 8 or so listed here, and we realize that while the team that we'll introduce doesn't cover all of these areas of expertise, we wanted to make sure that we could begin to craft questions that either the team could answer or that we could answer through the rapid response grants, and we would reach out to experts across the country to answer these questions. But this is just to give you a sense that we're looking at healthy kids that begin at pregnancy and maternal health, looking at issues of behavioral economics, out-of-school time settings, and then all-inclusive of issues of racial and ethnic minority and low-income populations. And you'll see that this last bullet is a thread that is addressed in all of the research studies. Next slide. So here's our team. This was taken at ALR, I guess, last February. So you can see Carmen, Myron, myself, Jim, Keisha, and Chad. And then we have other members of the team that are listed on the following slides. We'll go to the next one. PARC is really just beginning. So we started in February with our planning grant, and that ended sometime in June or so. Maybe it ended really in August, but we submitted most of our materials for review in June and then moved ahead with the full grant. We have a multi-site team, and so the team, as you saw in the previous slide, represents UC San Diego, Georgia Tech, Johns Hopkins, and NC State. Our purpose is to conduct research, and that's an important emphasis. There may be some confusion over the involvement or the participation of a lot of the ALR staff, where ALR, the focus there was not necessarily to conduct the research. That the focus for us is conducting research. We have a communications focus, and then the research is designed to inform our WJF policy priorities, as you saw on one of the first 2 or 3 slides. Next slide. So the goals for us from this spring were to obtain diverse input on strategic research questions for each of the target topics, that list of 8 or so topics. This was done through an online survey. Then we had a number of invited in-person meetings and then individual consultations. We then used the input from all of that information to inform a small number of studies that PARC is now conducting. We added, identified and then added research team members to fill the gaps in expertise, and then proposed those research studies that will be accomplished over the next 2.5 years. Next slide. So here's the full set of teams. So myself at Georgia Tech with Anna Kim as my co-PI, Jim Salas and Terry Conway at UC San Diego, Myron Floyd and Aaron Hipp at NC State, Keisha Pollack and Renee at Hopkins, and then we have the fabulous team of Carmen Cutter, Chad, Amanda, and Deb at UC San Diego providing a lot of admin support. Tina Koo is our program officer, and then Tom Schmid, who you all know is our super duper advisor from CDC. Next slide. So here are the 4 research questions that we're focusing on, and I added in the categories that they fall under, so you can get a sense of which categories we're addressing issues in. So the first is infant, child, and adolescent development, and the question that's being addressed here, and this is by the UC San Diego team, is generally where do middle school aged rural and urban youth from different racial and ethnic groups spend their time during the summer and school year? And we'll hear from, I think Terry is going to present more details on their study. The second study is the one we're producing here at Georgia Tech that is focused on advocacy by kids across racial and ethnic groups as well, facilitated through Boys and Girls Clubs. The third one is Play Streets that Renee is going to be presenting on, I believe, and that one is looking at how Play Streets promote physical activity in preschool and elementary age kids among different race or ethnic groups. And then the last on Parks and Rec, Trails and Open Space that Myron and Aaron are working on focuses on how children under the age of 14 from different race or ethnic groups use parks. Next slide. So this just gives you a very broad overview of the study populations that I think is helpful for everyone to get a sense of how and where we are addressing low income broadly, and then the subpopulations specifically. We know from a recent RWJF publication that while there were gains made in kids being at a healthy weight, the gap has widened for racial and ethnic minorities in that respect. And so we are looking at urban, that's U, and rural, that's R, along these subcategories for each of these research studies. Next slide. Well, why don't we go back, or maybe we can pause here and see if there are any questions. Amanda, is that what you'd like us to do?
Sure, I think that's a good idea.
Great. So I gave you a whirlwind run through Park, knowing that we have at least 5 other voices to present. So why don't we take some time just to answer any questions on the overarching Physical Activity Research Center, and then we can get into the individual research studies.
Did you want to just mention the rapid response grants, or is that?
Sure, I can mention those, and I can ask Carmen to correct me where I'm wrong. So we are looking at providing rapid response grants that will address some of the priority areas that have been articulated through our relationship with Voices for Healthy Kids. We've talked about completing 6 to 8 rapid response grants. That would be in the general range of about $50,000, and we're in the process of identifying which questions will be answered through that process. Did I miss anything that we should add? Or Tom or Amanda?
No, I just thought people ought to be aware that those exist as well as the core studies.
Great.
And this is Amanda. Maybe just one comment before you get started with the project presentations, for folks to be thinking about how, especially those of you that are in the working groups, how there might be connections and potential for collaboration with some of these projects.
Thanks, Amanda. We welcome that. Okay, so hearing no other questions, I'll go through the YAS study, and then we can see if there are any quick questions, and then move on to the others. All right. So the study that we're conducting at Georgia Tech is titled Physical Activity Advocacy and Training Among Youth in Low-Income Racial and Ethnic Minority Communities. It's based on some really great work that started in California using the YA curriculum, which is on youth advocacy for health. That was developed through the Obesity Collaborative through their health department. So our aims are to assess the impact of youth advocacy training on participants' attitudes and beliefs and physical activity across racial and ethnic groups, to assess the adult leaders' characteristics, the group structure and dynamics, barriers to success, and technical assistance needs to implement this kind of curriculum that has been shown through some early evaluation to be effective in a number of the areas highlighted in Project Aim 1. The third aim is to assess the decision makers' perceptions of interactions with youth advocates. So the youth advocates will present their recommendations to decision makers, and we'll assess their perceptions of the interactions with those youth advocates. And then the last is to assess policy, systems, and environmental changes resulting from this YA curriculum that will take place in about 24 clubs across the country. Next slide. Next slide. Thank you. And so I'll just quickly say that there were lots of studies on physical activity promotion through education, but we still see that there's a great gap today, despite the various interventions that have happened. So this study assesses how training needs to be advocates for physical activity in their environment, and policy changes can create positive individual change in youth, adults, and decision makers, as well as produce positive policy systems and environmental change in their smaller local environment. Next slide. And so we are working with cohorts of lower income middle school age children in 6th, 7th, and 8th grades who participate either in the Boys and Girls Clubs in the communities that we're targeting or other youth serving organizations. We likely will go to non-Boys and Girls Clubs for some of the Native American youth and Asian and Pacific Islanders. So you can see what our target numbers are there. We will work with 8 to 12 middle school kids in individual groups at these Boys and Girls Clubs or youth serving organizations for a total of 384 max. 256 is our minimum. And the setting are urban and rural places across the country that include Georgia, California, possibly Florida, and we're still looking perhaps at Utah or Minnesota. So I just wanted to introduce you to some of our project staff. We've learned from the YA evaluation that you really need to have someone who can help facilitate the leaders as they're helping to move this curriculum, to administer this curriculum with the youth. And so we have a great facilitator, Neil Walker, who is at the Boys and Girls Clubs here in Georgia, and he'll serve as the national facilitator for the YA curriculum over the next 2 years. Next slide. And then we have 4 study advisors. You don't see Leslie's picture. It's really hard to find a photo of her, but she's helping us with Latino recruitment. Sefa Aina is working with us on Pacific Islander recruitment. And then Rachel Milstein, who worked with Leslie on an early evaluation of the YA curriculum, she's at Harvard now, is helping us with the YA curriculum generally and evaluation. And then Tom is ever present with us, are leading and advising us as we move along. Next slide. So I just wanted to give you a quick timeline. We're doing recruitment this fall, prepping all of our assessments. In the spring, we move into actually implementation of the curriculum in our intervention groups, those 8 comparison groups, and then the 16 intervention groups, that's the 16 YT groups. Summer, we will do all of the post-assessments and then some pre-assessments for what will be the delayed intervention groups. So our control groups will receive the same intervention in the fall. And then in January, we have all of our post-assessments, interviews, policy systems and environmental change interviews, and then we move into data analysis, writing, and dissemination February, August. So you can see that really quick. And we're excited to be doing this research. I think that's it for me. Why don't we take any questions, unless you think it's probably better to move on to other presentations and take questions at the end, Amanda?
We can take, if there are any questions, maybe 1 or 2 questions now.
Okay. I wonder if there are any partners or those on the call that see opportunity to provide guidance on recruitment or have experiences with a similar curriculum that may want to reach out to us or provide some words of wisdom.
Anyone on the call that has worked with youth advocacy projects before has any thoughts or?
So this is Jamie. Nisha, thanks very much for the great presentation. I wonder if you guys have reached out to MICFA Challenge that's located here in Chicago. The whole organization is focused on youth advocacy, and they do a ton of work with, primarily underserved high school students in the Chicago public schools. And they focus on a whole host of issues ranging from nutrition to physical activity to just broader civic engagement. So I don't know if it's a group you're familiar with, but it's one that you might want to look into.
Great, thanks, Jamie. I made a note of that.
There was a question from someone if you could share your PSE interview questions.
Oh, yes, we're happy to. I don't have them quickly at hand, but I can share them with Amanda or Keisha, and they can send them out. Happy to, Stephanie.
Great.
All right, so any other questions before we transition, or feedback before we transition to the next presentation? All right, thank you so much, guys.
So with that, we are going to turn it over to Renee, who's going to talk about the Play Streets project. If you're not speaking, if everyone could make sure your phone is on mute so we eliminate any background noise. Except for
Amanda,
Renee.
Can you hear me? Can you hear me?
Yes.
Okay. Perfect. So I am going to talk about the Creating Safe Places to Play, or the Play Streets project, that Keisha Pollock at Johns Hopkins Bloomberg School of Public Health, who we're all familiar with on this call, and then myself, and I'm actually at Baylor University. And you can see the title, and we're really excited about this project and this opportunity. Amanda, will you go to the next slide, please? So just some background. Across our country and actually internationally, play streets are being implemented in urban areas as temporary street closures that for a specified time period create safe places for play. And play streets are really considered and practiced mostly one way to address health disparities in children's health and physical activity by providing safe places for children in neighborhoods to be physically active. Especially places that have limited or without access to self and well-maintained parks and playgrounds. And really, as I mentioned a second ago, to date, play streets have primarily been implemented in urban environments. And so because of this, there are several questions about how play streets might be implemented for children from various racial and ethnic backgrounds who live in rural, low-income communities, and how these might differ. I'm going to go to the next slide. Thank you. And so for those of you that are part of the rural working group, and those of you who have done rural work in addition to your other work, some of this information is not going to sound new at all. But just a little bit of background and why to focus on rural communities. And some of the obvious things for those of us who do rural work is this idea around that there really are limited resources and oftentimes greater challenges within some rural communities and many rural communities that can widen disparities between urban and rural children. And so this idea of using kind of a temporary place, a street that are very prevalent in rural areas has a lot of promise. And we're excited to be able to look at how this idea, this intervention piece might work in rural areas and look at the potential around that. So the purpose, overall purpose, is really for us to document how play streets can be planned and executed to appeal to racially and ethnically diverse rural and low-income communities, which could help direct limited resources to populations most likely to benefit and focus on play streets attributes and/or elements that are most likely to increase physical activity in rural and in these diverse communities. And so I'm just going to walk through these next few slides are some of our specific aims for the project, and I'll fill in a few details around the methods that line up with these and sort of some timeline on where we are. But I felt like this was a good way of overviewing the project and where we're moving. And so we currently are in the middle of conducting a systematic review of the literature and are soon to begin key informant interviews to understand how play streets have been implemented. And we're looking internationally as well as within the U.S. and really trying to understand the emphasis that has already been placed on cultural relevance within a lot of these play streets that have been implemented already. There are a number of different play streets. Chicago is another place that has a lot of play streets that have been in play. And in fact, Keisha and I went and did a site visit up in Chicago a few weeks ago. And the Partnership for Healthier America had some smaller grants that went out a few years ago. And so we really do want to find out what has been working, how are these play streets been implemented in some diverse areas, and what's worked and what hasn't worked. With the idea that those key informant interviews and the information gathered from that process and the review of the literature will provide us a lot of background information to move forward with providing mini grants to organizations and select rural low-income communities to plan and implement multiple, so at least 4 play streets per community, culturally tailored play streets, building on lessons that we learned from our first specific aim. And those will be, we're planning on having those occur next summer. So we will be working on putting together our call for proposals, which will be a limited call for early spring, mid-spring, and into recruiting those communities and working with them to prepare for their play streets that they'll be implementing next summer. Into the next slide, Amanda, please. The third aim we have is to actually conduct an implementation research project guided by REAIM, and we'll be using mixed methods. You've heard me talk a little bit about some of those in the planning phase, but we'll also be using additional mixed methods throughout the implementation phase to understand how play streets are implemented with an emphasis on how they are culturally tailored for African American, American Indian, Caucasian, and Hispanic children residing in low-income rural neighborhoods and communities. And those will be focusing in on elementary and middle school aged children. And the next slide. Thank you. Our fourth aim is to, during these events, measure children's and parents' physical activity levels while at the play streets in rural communities, and also to document impacts of having play streets on families, organizations, and communities. And we'll be doing this through the use of pedometers, SOPARC for observation purposes, and then some surveys and additional focus groups around within each of those communities. And our fifth specific aim, in addition to disseminating through academic areas, it will be to develop a resource guide partnering with Change Lab Solutions to describe how to plan and implement culturally tailored play streets in low in rural low-income communities, with the hope that that will, from the lessons that are learned and from our work within the REAIM focused implementation research part of our project, that we'll really be able to provide some guidance for other rural areas. And I think that's my last slide, so thank you.
Great, thanks, Renee. Questions for Renee? There was a comment that was sent in. I'm not sure if it was sent to everyone, but Arnold Schur said he worked on play streets in San Francisco with Dr. Susan Zess, and she may have a publication on the studies that she conducted. So possibly you've already found that in your literature review, but if not, maybe, I don't know if Arnold, you have your audio turned on, but it would be great if you could send us that publication. I think I might even have the email address for Susan. I think she's attended our conference before.
And Arnold, if you can hear me, is that the one that was just recently published within the last few months? Maybe, maybe not. But yes, if anybody has any connections, or if you've personally worked in play streets or within the open street world where part of your open streets was included a play street idea of closing down part of the street for specific play purposes, that idea, then please connect with Keisha or myself and forward those names and contact information, or let us know, because we definitely do want to make sure we find as many people as we can to speak to about this as we are in this formative work phase.
Renee, this is Nisha. It looks like Aaron has published with her in the past in 2012 and 13, so he may be a good direct connection, and he's probably presenting next or soon.
He might be next. Thank you, Nisha.
And so Stephanie Meyer at NC State also said that their community has done this, and so, North Dakota State. Sorry, so I just saw the NDSU, not NCSU. So I don't know if you have audio, Stephanie, but I'll take down your email address so that Renee and their project team can get in touch with you.
Thank you, Stephanie.
Are you able to hear me?
Yes, we can hear you.
Okay, I didn't know if it would work. So we're in Fargo-Moorhead community, and we called it Streets Alive, but it's the concept of closing down your streets for active, anything active. We've done it for about 5 years, I think maybe our 6th year this next year. We've tried to collect some data at NDSU here in Fargo, but I think I'd be happy to connect with you and share some anecdotes and maybe be part of the process, however you see that fitting. But we've done this for a number of years.
Wonderful. Thank you so much, Stephanie. We will connect with you.
Any other questions or comments? Oops, sorry, I just clicked on something.
Hey, Renee and Amanda, this is Anush Hansen in Maine. Can you hear me okay?
Yes.
You can?
Yes, we can hear you good, sorry.
Okay, good, sorry. Renee, I'm sure you guys have thought through this already, but could you talk a little bit about how seasonal differences or climate issues and barriers might be measured through some of the work that you're going to be doing?
Yes, we have thought through it a bit, and at least for this initial project, and we see this being bigger than just the 2 years part of the park, one of the park core projects. But the initial phase is to look at just the summertime as when play streets are implemented, and we are going to be looking and collecting information at our geographical location of our communities is going to be intentionally different. We won't be able to capture every possibility, of course, but at least in terms of this first phase, we're focusing on the summertime, and a lot of that's around some of the evidence that really shows that we have increased weight gain in the summertime and oftentimes less physical activity. And so we're going to at least start there for now. There is some work that's happening in other countries that's looking at school year types of events, and some of the work within the states is usually focused in the summer, but sometimes spans on each side of it. So I think we'll be trying to capture what's different within our communities from this specific project, and we will be recruiting from different locations, not every different, as we know, rural is diverse within rural as well. So we're trying to at least capture some of that from the first phase, from this first project.
Great, thanks, Renee.
Great, thank you, Renee. And if anyone else has any questions or comments, you can get in touch with the coordinating center, and we can put you in contact. Renee is part of the network, so you may already have her information as well. So I think we should move on to the next presentation. So I'm going to turn it over to Terry Conway.
Oh, hi all. Is Jim on too? I don't know if Jim wants to chime in at any point.
Terry, I think Jim said that he's happy to answer questions, but you should probably proceed with the presentation.
Okay. So, Amanda, if you can move the slide forward. Or is it just my computer that's not seeing it?
I do have it pulled up. Still the presenter, Eric?
Sorry, yes, you still are.
So we see specific aims to measure children's and patients' PA while at play streets.
That's what I'm seeing, but that's not the next study.
Okay, hold on. I think give me 1 second.
There we go. Sorry, I apologize for the low-tech slides here, but I'll just give for the GEMS, the SALIS UCSD Teams Park study, I'll give a little bit of an overview. By way of background and rationale for the study, there's existing research that has shown, somewhat surprisingly, that adolescents have lower physical activity and more rapid weight gain during the summertime than they do during the school year. There are also documented race and ethnic disparities in health indicators, including weight gain, that widen during the summertime. And another high-risk group, rural youth, which is also an understudied group, also seems to be at higher risk for obesity compared to their urban counterparts. So these represent relatively diverse, high-risk groups of adolescents that we think it's important to try to understand both physical activity patterns and opportunities, barriers, and so forth that might be specific to these groups during both the school year and the summertime, and gaining a better understanding of these factors will help us inform tailored solutions. If you can go to the next slide, Amanda. Overall, our study aims are to examine physical activity patterns, including timing, intensities, amounts of both physical activity and sedentary behavior, as well as the places where physical activity occurs and other related factors in these diverse subgroups of adolescents. Also, all of the adolescents we'll be studying are in low-income areas, which puts them at higher risk for some of the physical activity and obesity issues. Our data comparisons will be made across 3 dimensions, comparing summertime versus the school year. So we have a repeated measure of all of our measures. We're going to be examining, comparing our race-ethnic subgroups, and where we can, we're also going to be making urban and rural comparisons. We're only going to be able to do this in the 3 largest race-ethnic subgroups, just for feasibility purposes related to budget and timing. Our target population is similar to some of the other studies. We're going to be looking to recruit 360 middle school age adolescents, all living in lower income areas. And we will be recruiting specifically to represent the 6 major U.S. race ethnic groups, African Americans, Latinos, Asians, Pacific Islanders, Native Americans, and white non-Hispanics. And as I mentioned already, for just feasibility purposes, in the three largest race ethnic subgroups, African Americans, Latinos, and whites, and non-Hispanics, we will be recruiting both from urban areas and rural locations, so we can make those comparisons. The next slide, Amanda. Our research design will be to assess adolescents two times, once during the school year, spring semester, and once during the summertime. And we will be including a nice diverse set of measures, both objective and self-report. Our objective measures will include physical activity and locations where physical activities occur. We'll be doing this assessing objectively by using accelerometers and GPS devices. We will also be using GIS and mapping data so that we can map locations of parks and schools and other locations where physical activity occurs in our sample, and we'll be determining this using GPS and linking the GPS information to accelerometer data. And then we'll also have a rich survey of self-reports on specific types of physical activities and sedentary activities, the patterns and places where they occur, as well as perceived barriers, opportunities, and preferences for activity types and locations that adolescents would like. So the research findings, we hope, will be the basis for making recommendations regarding policies and environmental changes that can be used to promote summertime physical activity and be specifically tailored to these high-risk subgroups. And that's an overview in a nutshell. Yeah. Any questions?
Terry? Any questions for Terry? Okay. Are any thoughts from the working groups about potential collaboration? It says Ingrid typed in a question. Will you be exploring negotiation or coping with the barriers, constraints you're assessing?
Did you say negotiating? I didn't quite hear the question.
Yep, sure. It says, will you be exploring negotiation or coping with the barriers / constraints you're assessing?
Well, I'm not. Well, we're definitely trying to get a rich assessment of indicators of these types of barriers and opportunities and so forth, with an idea towards coming up with recommendations for how they could be dealt with. So I think the answer to the question is yes. Well, we won't be doing that in an interactive way, but I think we will be taking the information that we gather and making comparisons, especially how things change in the school year versus the summertime, and looking at locations and barriers in particular locations, for example, will help inform us about recommendations for policy or environmental changes. For example, if we find that kids can go to parks but they're not active in parks, then hopefully we'll try to come up with recommendations and for programs that could be delivered or made available to people so that they can be more active in parks. I don't know if that's really addressing the question or not, but we're certainly going to try to come up with recommendations for solutions that are tailored to the subgroups and the barriers and so forth that they indicate they have.
Yeah, so her follow-up question was the definition of barrier, the physical versus psychological. So
I think we will have indicators of both of those things,
okay.
Both sides. In fact, that's why looking at some of the GIS measures and where kids are active and where they're not, well, especially where they are going and whether or not they're active there. as well as the self-reports, which will give us a lot more rich information to augment the objective data, will help us come up with proposed solutions that might reflect environmental changes as well as just policy changes.
Thanks for that, Ingrid. Yeah, I think constraints is a more common word used in maybe parks and recreation literature, so she was just trying to understand what exactly barriers we're referring to.
Yeah, I think they could be environmental barriers. Places where they don't have safe areas to play, or they don't have sidewalks to get to places, or they don't have bike lanes. So it could be constraints related to physical barriers as well as just programs that don't exist that kids would like to have to be more active. And because part of what we're going to be asking is preferences for activities and what they'd like to do relative to what they don't have available. So that would and barriers, psychological barriers, are sort of often a common correlate of activity. And if we can identify that, if they had friends to be more active with, going to programs, maybe that's the kind of thing we could help address in promotion of activities and programs. We'll be exploring the full spectrum, I think.
Thank you, and I'm just going to pull up the next presentation and then turn it over to Erin. So just give me 1 second. I've lost my presentation there somehow. Okay.
Thanks, Amanda. While you're pulling that up, I will say that that I've been in email and phone conversations, obviously, with Renee and Keisha about some of our Open Streets work, and I think I've shared Susan's Open Streets and Play Streets work, but certainly I can do that again.
Oh, good. And Arnold sent a citation as well that we copied from the chat box, so perfect.
Cool. Great. Yeah, hi, everyone. Good afternoon. Good morning. This is a placeholder acronym. Myron is not, he told me I could go ahead with it for now, but he's not completely on board. Pamlico is the largest sound here in North Carolina, but the actual project name is Park Use and Physical Activity Among Children in Low-Income and Racial and Ethnic Minority Communities. So Myron Floyd, our department head here in Parks, Recreation, Tourism Management, is the PI, and he is currently out of town. Myself, we've got a postdoc helping us out, Oriole Marquette, and a PhD student who's serving as our project manager, Claudia Alberico. So next slide. We have 3 aims for the project. So the first is to identify social, environmental, and programmatic attributes of parks that associate with parental decisions about children's use of neighborhood parks. We are looking to compare how children from different racial and ethnic groups use parks and the related recreation facilities. And we seek to determine the extent of specific park characteristics, features, programs, and social context that associate with children's physical activity. And here, children's physical activity, we're primarily looking at kindergarten through 5th grade. This project will occur here in Raleigh-Durham, in Wake County and Durham County, as well as in New York City. And our partners for New York City is Gina Lavasi, who some of you may know. She was at Columbia when we initially wrote the grant, and she moved to Drexel over the summer in Philadelphia, but she has assured us that New York City Parks are still on board. And it helps that the New York City Park Commissioner used to be the Raleigh Parks Commissioner and knows Dr. Floyd, so that's been a nice connection. Next slide, please. So per site, Raleigh, Durham, and New York City, we're locating 20 parks. These are parks greater than 5 acres in size with at least 1 playground and at least 1 field or court that's available for use. And we are locating these parks based on this size and these attributes, but as well as being parks located in neighborhoods that that have certain thresholds of kids between the age of 5 and 10, meet our low-income definition that we're all using across PARC, PARC, and we are looking in North Carolina at primarily African American neighborhoods, and then in New York City primarily at Asian American and Hispanic or Latino neighborhoods. Next slide, please. So we with our aims, we have three ways we are going to measure or evaluate PARC use and barriers in these two settings. The first is a parental survey. This will be a telephone-based survey. We are working on it now, looking to keep it no more than 10 minutes, hoping to have a decent response rate. The inclusion criteria would be an adult in a home with at least one child between the ages of 5 and 10 years. They do not have to use parks, but that will be one of our first questions. We actually have two sets of questionnaires or surveys based on use of parks. And we're interested in barriers to use, programs, the quality of the parks. We do have a set of questions around management. We're very interested in the management side of parks because we feel like that's where there could be some leverage in improving parks. And we're interested in access, so not just the park itself, but the sidewalks, the crosswalks, the buildings, the built environment that surround the parks in these two urban environments. Next slide. There's Tom McKenzie. We will be using SOPARK, the systematic observation of physical activity and recreation in communities. We will be looking at activity level, gender, age, and race ethnicity. Next slide. And then we're going to do park-based physical activity. We're going to evaluate park-based physical activity using accelerometry and GPS. So we will recruit families, specifically children, in the park setting to wear a GPS and accelerometer during their visit to the park. We will go to the 40 parks, 20 per site, beforehand and geolocate every piece of play equipment and draw a box around every field by walking the fields with handheld or backpack GPS units. And then we will have a set of children who will be recruited in each of the parks to wear an accelerometer and GPS during their visit. So we've got SOPARK to give a systematic observation, and then we have accelerometer and GPS to give us kind of that individual level look at where, when, and how active youth are being. We do have a set of partners. That is Gina Lavasi there in the top left at Drexel and their new urban studies program. We have three sets of professional partners who we're working with on throughout the project, but especially on disseminating and communicating our findings. One is the National Recreation and Park Association. The other is the National Park Service and their Healthy Parks, Healthy People program. And the third on the far right there is Recreation Resources Service. And that is actually based here at North Carolina State and is part of our extension efforts at North Carolina State. It's actually a national program that looks to educate, inform, and help fulfill those continuing education units for park and recreation professionals and managers. And so those three groups will be helping us throughout the process. And Myron is actually participating in a supervisor's management retreat right now through our RS in West Virginia. And so we're excited about the opportunities that these three organizations present to us to make sure our research and our communication of the results are going to have the largest impact. And that's all I have.
Great. Aaron, I apologize we're going over a little bit of time, but I appreciate those of you who stayed on, and we'll take some questions for Aaron and then just wrap up with the open mic. So does anyone have any questions, thoughts for Aaron and his team? So a question from Arnold. In regards to observation of the built environment, have you seen the studies conducted by Dr. Abby King?
Yep. Hi, Arnold. Yeah, thanks. So I'm actually working with Abby on 2 projects using her neighborhood tool, and that's a nice question. We hadn't actually considered it for this project, but I do like the way that engages the community in research.
Thank you, Arnold. Again, if there are any thoughts, ideas that come up from this call for any of the projects, please get in touch with us. They wanted to present what they're doing with the network, just to see if there are any opportunities for collaboration. They'll be working in different communities across the country, and so if you have thoughts on recruitment and or any kind of surveys or things like that, or if you are interested in collaborating and potentially using the same measures for, an add-on study, that's also an opportunity. And also want the working group leaders to be thinking about any opportunities for collaboration on these projects. With that, we are going to go ahead and move into our open mic. I don't have anything. I know Jamie had a few announcements. Does anyone have any open mic announcements for us? Jamie, why don't you get us started, and we'll see if anyone has anything that's in their mind.
Okay, thanks, Amanda. Hi, everyone. I have 3 quick things. We're doing a webinar tomorrow for Voices for Healthy Kids on our qualitative work we had done for them on complete streets and equity. So if you're interested, I could quickly get that out to Amanda, send out this afternoon. We're also going to be releasing 2 reports tomorrow. One is a case study report from that and a research brief on the relationship between complete streets policies and active travel to work. So those will be posted live tomorrow, and I'll send that link to Amanda as well. But we are still going to move forward with additional work related to this under the Complete Streets Working Group, and I'm actively seeking grad students or investigators who are interested in coding the transcripts with me using Atlas. So if you are an Atlas user and are interested in coding our 17 or 18 Complete Streets interview transcripts to develop a manuscript in our working group, that would be great. If you are not an Atlas user but are interested or have a grad student who is using it and would like to work with me on this, please let me know. And then finally, Amanda, I don't know if this might be a possible presentation for the January call, but Amy Eiler and I, many of you know Amy. Amy's at Washington University in St. Louis. Amy and I are the recipients of a new Policies for Action, RWJ Policies for Action Research Hub focused on children's healthy weight. And we're a complement actually to PARC and to healthy eating research, and we're studying the actual implementation of policies across the country and ultimately their impact. We also are on a short 2-year time frame, and we have 2 of our 4 research studies so far are physical activity oriented. One's focusing on studying implementation of the new Head Start PA standards, and another one's looking at pay-to-play policies across the country and studying their implementation and impacts on low-income communities in particular. So I don't know, Amanda, that might be a nice presentation for the January call where we can do something similar to what PARC just did. And we also will be doing some small-scale rapid response type projects as well related to Voices for Healthy Kids priorities, but we don't know what those are yet. And we have a nutrition study as well, but that's not of interest to this group.
Yeah, that's a great idea, Jamie. I don't think we have a presenter lined up for January. That's a good idea. And if you definitely can, I think I have the information, but if you have it handy and forward it to me, we'll send it out to the PAPRN network. That's the resources. Sure. Any last minute thoughts or comments before we close out the call today?
This is Tom. Just an invitation to the park folks to join one of the PAPRN work groups if you're not already in it. Great group of people.
Very good invitation. We do have some of the folks that are already involved. Renee is obviously the working group leader, so and Keisha. So, but we encourage you to join a working group. I'll send out the information for that. If there's nothing else, I'll wish everyone happy holidays. We won't connect again until next year. But we will be in touch before then, obviously, with some of the follow-up items from Jamie, and also just to kind of give an overview of the park presentations that we heard about today, and encourage you to reach out to them. And if there is there anything else that you want to be sent out to the group in the meantime, please forward that to us. We're happy to share around resources and things like that in these kind of hiatuses between our calls. All right, we'll close out for the day, and thanks to everyone for sticking past the top.
Thanks all. Bye-bye.